Thank you very much again for inviting me. So today I would like to actually share some of my research regarding sarcopenia, which is the title of effectiveness of protein supplements and exercise among elderly individuals with sarcopenia. So as an introduction part, the definition of sarcopenia is actually consists of three criteria, which is loss or decrease in muscle mass, loss of muscle strength, and loss of muscle function. So according to European Working Sarcopenia on older people, the definition has been divided by three stages, which is pre-sarcopenia, moderate sarcopenia, and severe sarcopenia. So the consequences of sarcopenia is actually will cause disability in elder people, increased incidence of falls, dependent on others, and social problems such as depressions. So there's a way how we can treat the sarcopenia, whereby using the exercise training, mainly for focusing on the resistance training, and as well as the nutrition supplementations, which is actually focusing on protein supplementations. And this is some examples of prevalence and diagnostic method that have been used in previous studies, whereby by Chin et al. 2008 in Taiwan, and also Jansen et al. 2004 in USA, have been used method using the bioelectrical impedance BIA, and it will be, the diagnostic is actually using the skeletal muscle index. It's actually muscle mass that divided by height. And the prevalence of sarcopenia that we get is actually for men for 23.6% and for women 18.6%. And Lee et al. 2007 in Hong Kong also using the different method, which is using DEXA. And they found the prevalence of men and women is actually slightly lower compared to the first author, Chen et al. 2008, which is in men about 12.3% and for women 7.6%. So another way how we can actually use this diagnostic method for the sarcopenia index, which is actually using the gait speed. Okay, this table is actually showing the summary of clinical trials that using the exercise training on body composition and physical health in elderly. So for the Islam et al. 2004 in Japan, the participant will be divided by two main groups, which is control groups and training groups. And the mean age for this study is about 76 years old and above. And the duration of study is about 12 weeks, which is giving the exercise intervention about 2 days per week. And the durations of the exercise is about 60 minutes per day. So for this part, for this study, what this Islam et al. Found is actually the resistance training in training group shows significant improvement, about 80% in lower body muscle strength as compared to control group. And Nakamura et al. 2007 in Japan is actually divided by four main groups for control groups and another treatment groups. Three treatment groups is actually based on how many exercise training have been given to the subject, which is the first group is about only once per week, the second group twice per week, and for the third group is three times per week. So for this exercise program, what Nakamura et al. Have done is actually they're giving well-rounded exercise to the subject, whereby 10 minutes warm-up, 20 minutes walking, 30 minutes recreational, 20 minutes resistance training, and 10 minutes warm-down. So what Nakamura et al. Find for this study is actually the greatest improvement have been found in body fat, muscular endurance, and dynamic balance in group 3 as compared to control group, and improvement in body composition only in group 3 compared to control group and group exercise 1 and group exercise 2. So we can conclude here that the improvement of fitness in older women and exercise frequency at least 3 times per week should be implemented to this population. So Reddit et al. 2005 also done a similar study and compare only two groups, which is intervention group and control groups. And the exercise program also is actually well-rounded. It consists of the warm-up, resistance training, and also warm down and also walking. So what this study found is actually the balance and mobility was improved significantly in the intervention group while decline in control group. So what we can conclude here is actually the physical training program may improve functional capacity in elderly people with multiple diagnoses. So this actually table that show the summary of clinical trials for the exercise training and nutrition therapy, which is combination of exercise or nutritional therapy on body composition and physical health in elderly. So February and all 1994 in England has shown that there will be 5 main groups that will be implemented in this study, whereby resistant training, placebo, nutrition supplements, resistant and nutrition therapy, and also placebo supplement. So for the mean age group is 72 to 98 years, and the result shows that resistant training has improved muscle strength and size compared to control group about 90%, and there will be an improvement in about 125% of improvement in muscle strength for the resistant and nutrition therapy group as compared to control. So we can conclude here supplementation alone had no primary effect on muscle strength and fat-free mass. So for the purpose of the study, is actually to identify the prevalence of sarcopenia among elderly and to evaluate the effectiveness of exercise and protein supplementation is either alone or in combination on sarcopenic elderly, and its relationship with body composition, functional fitness, oxidative stress, and quality of life among elderly with sarcopenia. So this is a conceptual framework of previous research. We know that sarcopenia is actually have a few causes that come from the diet itself, the socio-demographic, the aging process, lifestyle. Our lifestyle is low physical activity, and the aging process such as loss of muscle mass and high oxidative stress. So this sarcopenia can be treated using these two mechanisms, which is increasing in physical activity and as well as diet supplementation. So this we hope that it can decrease loss of muscles and improvement of function and quality of life. So location of study is actually at low-cost housing area around Cheras, Kuala Lumpur, and it's divided actually into 2 phases. The phase 1 is actually screening phase, and for the phase 1, the study design is convenience sampling because we already determined the area of the research study, and it involved about 388 elderly. Okay, and for the phase 2 is actually our intervention phase. Our study design is actually quasi-experimental design because we determine in which place or area that we will be given such intervention package. And the subject for phase 2, we actually can identify about 75 sarcopenic elderly to be included in phase 2. But because some dropped out, we only managed to have 65 sarcopenic subjects, which consists of 47 men and 18 women, which mean age 65.1 years old and above. So we divided these participants to 2 main groups. Basically, this is actually 4 main groups. But for exercise group, we're giving them stretching exercise, resistance training exercise, which is using elastic band, balance exercise for twice a week, and the durations of the exercise is about 1 hour per session. So for protein supplementation group, we receive soy protein supplementations that is actually in the market, and we give about 40 grams per day in men and 20 grams per day in women. So for phase 1, okay, we screen about 288, okay, and we check on the body composition, muscle strength, using hand grip strength, and biochemical analysis as well as questionnaires. And it's actually the determination of sarcopenia using cutoff point by Jensen et al. 2004. And whoever have met the inclusion criteria was selected to participate in phase 2. So this is the inclusion and exclusion criteria. And for skeletal mass index cut-off point, we divided to the two, which is moderate sarcopenia and severe sarcopenia. So for men, for moderate sarcopenia is between 8.51 to 10.75 kilogram per meter square, and for women is about between 5.76 to 6.75 kilogram per meter square. And for severe sarcopenia is less than 8.50 kilogram per meter square, and for women is less than 5.75 kilogram per meter square. So for the phase 2, we are dealing with about 65 males elderly in Cheras, Kuala Lumpur. So it divided for basically 4 main groups: control groups, resistant exercise groups, protein supplementation group, and the fourth one is combination of resistant exercise and protein supplementation group. So the data will be collected at 0 week, which is during baseline, 6 week, and 12 week of intervention. So the data that we collected is actually anthropometric questionnaires, okay, body compositions, they're using BIA, Metron 916, and blood parameter and biological markers such as hormones, IGF-1, IL-6, and also oxidative stress. And this is sample of the booklet and CD and elastic band that we used for the exercise group. This is actually to help the elderly people to do home-based exercise, because this video is actually consists in how the exercise of resistance training will be conducted. And this is some sort of this picture that showing that the elderly people that doing the exercise at the center, the researcher will help them to actually conduct the exercise in a proper way. Okay, so this is sample of poster that we use for this intervention study that consists all of exercise, started for the stretching exercise, resistance exercise, and also the balance exercise. Okay, so this is actually the record book that we use by the participant to actually check on the compliance and how they actually do their exercise at home. So in here they have to tick in which day they actually do that exercise, and either they take the supplementation of the protein that we give to them. Okay, for the first phase, we found out that there will be 70.9% of prevalence in moderate sarcopenia in men, and about 27.9% of moderate sarcopenia in women. So overall prevalence that we get from these populations is actually about 59.8%. And for the sarcopenia classification, it shows that 47% of men is actually having sarcopenia lean, and 24.5% of women is actually having sarcopenia lean. So the prevalence of sarcopenia in current study is different from other countries. So we can see that our prevalence in Asian population is actually slightly higher compared to other study. But we also can see that there's a similar study from our study with Jensen et al. 2006 in USA that shows that moderate sarcopenia is about, in men it's about 70.7% and women about 41.9%, and for severe sarcopenia men is about 70.1% and women 10.7%. And the method that we use is actually bioimpedance analysis. So the reason of this variability is actually because of the sample size, okay, and the background of the subject as well. Skeletal muscle assessment method, either they are using BIA or DEXA, and cutoff point used in determining sarcopenia. So the baseline characteristic for social demographic and health profile is actually was similar in all intervention group, and this helped in reducing probability bias among the groups in our study. So sarcopenia classification and gender were used as a covariates for the repeated measure analysis. And most of the subjects for this population were not working, unemployed, were married, and suffering from diabetes or systemic hypertension, and having some degree of visual impairment. So now we go to the effects of protein supplements and exercise on body composition, which is in phase 2. So there will be significant interaction effects have shown in muscle mass in men after 12 weeks of intervention, and it shows that the best improvement having seen in the exercise group as compared to other groups. And for effects of protein supplement and exercise on functional fitness, this functional fitness is actually being used to actually check on the physical functions of the elderly people. So we have a few tests that we conducted, such as chest stand test. We also have an arm curl test, hand grip strength, 6-minute walking test, and the rest. So for the first test, for overall chest stand test, is actually looking on the lower muscle strength. So there will be interaction effect having shown in this study, and it shows that group for the exercise and protein supplementation group as well as protein supplementation group alone have give a good significant improvement in the chest stand test. And for the arm curl test, which is actually looking on the upper body strength, so we can see here that improvement can be seen about around 50 to 70% improvement in the exercise group alone, and as well as exercise and protein supplementation group. For the foot up and go test, which is actually to determine the agility and balance of the participants or subject, we can see that there will be a significant interaction effects, and it shows that the best improvement can be seen in protein supplementation group alone, and as well as the exercise and protein supplementation group. So in men, we can see in lower body strengths there will be improvement in the protein supplementation group alone, and as well as the protein supplementation group and exercise group. And for the upper body strength in men, it shows that improvement in also protein supplementation group and exercise and protein supplementation group. So for women in lower body strength, we can see some good improvement, about 50 to 70% in protein supplementation group alone, and the combination of exercise and protein supplementation group. And for arm curl test, which is upper body strength for women, it shows that exercise group alone and protein supplementation group alone can show some significant improvement. For the effects of protein supplement and exercise on oxidative stress, we only can see the improvement for overall SOD. It's actually in the area of protein supplementation alone, as well as the men. So the SOD is actually improved tremendously in the protein supplementation group alone. So for the effects of protein supplements and exercise on quality of life, we found here that women have, which is the dimension of emotional role, improve in exercise and protein supplementation group. Maybe it's because of the when we give some intervention package to the elderly people in that area, they are very excited to meet their people in the centers and can be mingled around with their friends. So their emotional role is better before the intervention phase. And for the dimension of health, also we can find some improvement, which about 20 to 30% improvement in also combination of exercise and protein supplementation group. And this is also because of, for this group, we met them more regularly compared to other groups. So maybe the participant or subject is actually happy to meet the researchers, share some problems, and share some information from the researchers, so make them more happier during the intervention package. And for the effects of protein supplement and exercise on appetite and energy intake, so we can see the improvement in the appetite score for exercise group alone and for exercise and protein supplementation group alone. So from this study or results, we can see that exercise even twice a week also can improve appetite in elderly people. So for energy intake also is actually higher in exercise group and protein supplementation, the combination of it. And it actually shows that if you do some exercise and getting some intakes of extra protein supplementation, it also increase the energy intake. Maybe can related of because of the increment in your appetite. In men also, we found a similar effects whereby we can find improvement is about 20 to 30% of energy intake in men. So as a conclusion for this study, we found that the prevalence of sarcopenia is about 59.8% in overall populations, and for men it's about 80.9%, women 40.3%, and there will be no predator was found in this study. So exercise and protein supplementation, both alone or in combination, seem to improve muscle mass, upper and lower body muscle strength, oxidative stress, and emotional role, energy intake as in sarcopenia elderly in this population. Therefore, we should give both intervention modes may be suitable for prevention and treatment of reduction in muscle bulk and muscle strength among sarcopenia elderly. So as a conclusion, so I can conclude that more awareness should be given to the population of elderly to inform them that the exercise training, even though twice a week, for the resistance training that we can be done at home base, actually can improve their muscle loss and muscle strength. So it can help them to improve their daily activity. Thank you very much.